Welcome to the MamasteFit podcast. In this week's episode, we're going to be talking all about Diastasis Recti, also known as DRA, DR, abdominal separation. So this is the normal separation that occurs during pregnancy. So we're going to chat about how to decrease the severity of diastasis and also what you can do to heal it in the postpartum. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you.
So welcome. Today we're going to be talking all about Diastasis Recti or Diastasis Recti, however you say it. We get a ton of messages about the abdominal separation that occurs during pregnancy, how to prevent it, what to do when we see coning, like what is coning. It's probably one of our top comments that we get on Instagram, and the biggest fear, one of the biggest fears during pregnancy that people are afraid to get. So Gina, tell us, what is Diastasis Recti? So diastasis, DRA, abdominal separation, what that means is it's the normal separation of the six-pack abs. So the two six-pack ab muscles on the front side of your body, known as the rectus abdominis muscles, they're going to separate and they're going to stretch and spread apart from one another as the baby grows. And this is a normal adaptation to pregnancy. It needs to happen, otherwise all of our internal organs are going to get smooshed or a baby's going to have a hard time growing. And so this has to happen during pregnancy. If you carry your baby into the third trimester, you're going to have diastasis at some sort of severity. For some of us, the diastasis is going to be a lot larger. For some of us, it's not so much. For some of us, it'll just spontaneously heal in the postpartum. Others of us, we have to do more deliberate approaches to recovering in the postpartum period to help with that abdominal separation. But it's normal. It needs to happen during pregnancy. So there's no way to prevent it from happening during our pregnancy. But before we dive deeper into this week's episode all about diastasis, let's hear from one of our postpartum athletes, Kayla. I've been working through the postpartum 16-week program and I love it. I have been a runner and I've enjoyed lifting throughout my pregnancies, but after my third baby in 4 years, I felt very unstable and weak. I had a 4 to 5 finger diastasis recti too. I loved how my physical therapy exercises fit perfectly into this program and how they share alterations to the exercises to meet you where you're at. I'm 7 months postpartum and about halfway through the program and no longer feel pain, pressure, or instability. And most importantly, I feel like I've learned a lot about how to strengthen safely even with a large diastasis with the help of my PT and a great program. And so thank you, Kayla, for trusting us with your postpartum fitness. It means a lot to hear from you guys about how our programs are helping you during your pregnancy into the postpartum period. And it really means a lot to know that we are supporting you to recover after birth. And so if you're interested in our postpartum fitness programs or even our prenatal fitness programs, you can use code STORY10 to get 10% off any of our fitness programs. We offer a lot of different programs to support you in the postpartum period. We have our full-length program, which is going to be our general fitness and lifting program. And so this is going to help you to get back to basic lifts such as the squat, the deadlift, and the bench press. This 16-week program, the workouts are about 30 to 45 minutes long at first, and then they gradually increase to about 75 minutes in length. And so if you have a gym that you want to work out in and you have at least an hour to work out, the 16-week program is a great option. But if you are short on time, our 12-week program can be a great variation instead. The workouts are 15 to 20 minutes long, so they're much shorter, but you still get the same benefit of rehabbing your core and returning to fitness. We also have an on-demand program if you like to watch a video as you work out at the same time. And then we have our sport-specific program. So if you're trying to get back to Olympic weightlifting, getting back to running, or if you're a first responder or military service member, we have our military program as well. And so you can check out all of our programs at mamastefit.com/fitness-program. And again, use code STORY10 to get 10% off any of our fitness programs so that we can help you return to fitness and find your strength after birth. So back to diastasis. Can we prevent DRA? So no, not really. It's a normal adaptation. It needs to happen. And that's probably like the top question that we get on Instagram is, how can I prevent diastasis from happening? I've noticed some separation. My midwife pointed out that I had some separation. There is nothing that we can do to prevent having a diastasis other than have a preterm birth, which I would not recommend. That is not a good approach. So it's a normal adaptation. And once we understand that it's normal, we don't have to be afraid of it happening. And each of us is going to kind of have a little bit of a different experience with diastasis because there's so many things that influence how much diastasis that we have. The first thing is just going to be genetics. Like what is your tissue integrity? What does that just look like for you? Mm-hmm. How long was your torso? How big are your babies? And so Roxanne and I both have different levels of diastasis during our pregnancies, and our healing postpartum is a lot different. And so I, for one, don't grow as large of babies as Roxanne. So step one, I have smaller babies. Yeah, like a pound. Like there are just all the tiny stuff. And so because of that, my belly just doesn't get as big. And so I tend to not have a very large diastasis during pregnancy. I don't have a very big one postpartum, and then it just kind of heals spontaneously. I'm sorry. And I don't maintain a diastasis for very long after birth. And so for me, diastasis has not been like a huge deal or issue for me, but I know that it can be a big deal for people, and it can be something that can affect your function. So Roxanne, would you like to share your story?
Gina's over here like, I had no diastasis. She did, but it healed like within, I feel like, days of postpartum. Her diastasis had closed. Whereas me, I started coning earlier in my pregnancy, as well as I still have diastasis to this day. Where like with each subsequent pregnancy, it kind of just was more pronounced earlier on in my pregnancy, and then still stayed about like 2 fingers width apart. It's mostly around like my belly button. So even in the postpartum, I have to be mindful of like avoiding coning in certain movements and really engaging in my core, and as well as rehabbing it appropriately. But some of us, the diastasis will never heal necessarily or close all the way postpartum just because of the tissue. But it's more about functionality of our diastasis postpartum than like how big the gap is necessarily.
So before we talk about tissue integrity and the difference between like how deep your diastasis is and how wide it is, let's talk about what coning is, because not everyone may know what coning even means. And so when we talk about limiting the amount of coning that's happening or trying to prevent coning, let's discuss what that even means. So what coning is there's this connective tissue between your six-pack abs. And that tissue is going to get thinner as the six-pack abs are moving further apart from each other. So as diastasis is growing throughout pregnancy. And what happens is when we have too much pressure within our abdominal cavity, or maybe we're mismanaging that pressure, like we're kind of pushing it in areas it shouldn't be going, it's essentially going to go to the point of least resistance. And so the center of our abdominals is going to push out, and it's almost going to be like only that part pushes out, but the abdominal wall is still kind of pulled in. And so it's like the center of the abdomen is pushing out further than the rest. And it almost looks like this like hill or this like mound down the center of the abdominals, like right where the belly button line is. Now, this is different than doming. And what doming is the rectus abdominis, or the six-pack abs, are over dominant, or they're too strong for the transverse abdominis. And so that'll be like the whole abdominal is kind of pushing out, almost like a loaf of bread. And then you have this like sunken in portion right where the hip bones are. And if you're watching the YouTube video, we'll put pictures up so that you can see the difference between these two. And so doming is a activation strategy issue, while coning is a pressure management issue. So we have too much pressure in the abdominal cavity, or we're mismanaging that pressure, and it's pushing to the point of least resistance, and it's causing this like mound or like line down the center of your abdomen. And now the issue with coning is that it's pushing against this tissue, and it's stretching it and stretching it and stretching it. And so if you think about having like a hair tie, and you're putting it on your wrist, you put it in your hair, and you're just kind of stretching it, eventually it starts to kind of lose its elasticity. So it doesn't kind of bounce back. I hate using that phrase, bounce back, in a postpartum podcast, but the rubber band does not kind of spring back to where it was before. And so with diastasis, if we are constantly coning and coning and coning, and we're pushing against this tissue and pushing against this tissue, we're just overstretching it. And now there's a difference between a soft cone and a hard cone. And so a soft cone would be like, you're just chilling. I'm just lounging at my seat, and my belly's got a little bit of a cone. That's fine. There's no increase in pressure. It's just like your belly relaxing. Or if you were in like an inversion, or you were a tabletop position and you had some coning, it's just your belly relaxing. That's not an issue at all. It's just your abs are just like, bleh, I'm just chilling right now. Now, the difference between a hard cone is we have a hard cone where it's firm to touch, and this is from exertion or exercise, or we're increasing pressure and it's pushing against that linea alba or that connective tissue. And that's where we have the issues. And so soft cones are fine if you're in a restorative position, you're just chilling and your belly has that little mound down the center, it's not an issue. If you're exercising, you're picking something up, you're pushing something overhead, and you're seeing that coning, that's where we're potentially going to have an issue, and we may potentially be damaging that tissue a little bit more. So Roxanne, let's talk about some strategies to minimize coning, because I think that's, now that we've scared everybody, we'll say if you cone, your diastasis will be worse. Let's talk about some ways that we can minimize coning. So what caused coning for you during your pregnancy?
So a lot of the coning that I had was in overhead position. So like overhead press or pull-ups. Not that I am even able to do a pull-up, but like anything that I was pulling down, if it was too heavy for me, it was like a lot of coning. So lat pull downs, even banded lat pull downs sometimes, like as I got further in pregnancy. But mostly a lot of like overhead type movements caused my coning, and then certain like abdominal ones. So like if I found that in a certain movement, I was leaning back too much, that it like caused my abdomen to kind of engage a little bit, I would see some coning sometimes, depending on the amount of engagement that I was doing in my abs. So those are probably like the most common ones that I saw my coning in. And sometimes like getting out of bed, if I wasn't mindful to do my little ninja roll and I just like sat up like I was doing a sit-up, I would definitely see coning when I would do that as well.
So common reasons that I'll see coning for our clients in the gym is it deals with their positioning and how they're breathing, and then how hard is the movement for them. And so the first thing with positioning is they tend to be arching in their back. So they're finding this extension in their spine. And typically this is going to happen when they're pressing weight overhead as a compensation pattern. So they're arching in their back to push the weight up. This can also happen with vertical pulling type motions like pull-ups. So when we're engaging the lats, we tend to arch in the back a little bit. And this could also happen with movements that are very abdominal flexion focused. So think like sit-ups, crunches, V-ups. Even pull-ups, which are very core intensive, can sometimes cause coning as well. So the big movements that we see coning is going to be overhead pressing motions, because people tend to arch, and then vertical pulling motions. So like pull downs, pull-ups, because people tend to arch in those movements as well. So the big thing is the arching. If you just maintain a fairly neutral position as you are pressing weight overhead or pulling your weight towards you, we're probably going to not see coning in our movements. And again, we do want to minimize coning during exertion, because it's going to decrease the amount of damage that we cause to that linea alba. And so what can you do if you're arching in your back while with the overhead press and the vertical pulling motions? The first thing is we're going to decrease the loading. So we're going to make it a little bit easier, so that way we don't have to compensate during the motions. We can add external feedback, such as sitting down and pulling instead of doing a pull-up. We could have like a band that we pull down and then press weight overhead, because that helps us keep the rib cage down. And if these movements are not making sense, know that we have a whole YouTube video that has like 10 different exercises that you can do to minimize coning, and we'll link it in the show notes of this video. But we can do movements that help us set up a little bit better, decrease range of motion, decrease the loading. But ideally what we're looking for is we're trying to avoid that arching during exercises, which is going to cause that coning. The next thing that we can do is we can focus on our breathing. So how are we managing that pressure? Because again, coning is an issue of pressure, so we're not managing pressure properly within our abdominal cavity. And so when we inhale, we should feel an increase in pressure down into the abdominal cavity. What we don't want to do is inhale and have a belly breath. We're not trying to push all of our air to the front of our belly, because again, path of least resistance, where the weakened tissue is on the abdomen. What we want to think about is when we take our inhales, we're breathing into our backs. There's a lot more muscles back there. It's a lot stronger back there.
And so when we inhale, we're expanding in the rib cage and we're thinking breathe into the backside. And there's still going to be this 360 expansion that's happening around the abdominal cavity. There's going to be expansion into the pelvic floor, but it's going to be more evenly distributed as opposed to belly breathing where we're only pushing air into our belly. That's not a 360 breath and we're putting too much pressure towards the belly. So first thing, when you inhale, think I'm inhaling into my back, and this is going to give you more even distribution of pressure. The next thing is when we exhale, we want to think exhale to lift up and in. So I'm lifting up in the pelvic floor. I'm pulling my abdominals in, I'm engaging in my back, and all of this is helping to kind of push my diaphragm back to where it was. So we want to think exhale to lift up and in. If you're going opposite or you're doing like a reverse breathing pattern where you're exhaling down, that can also increase coning, increase pressure into the pelvic floor, because again, it's a pressure mismanagement. So we want to think exhale to lift up and in, almost like you're trying to pull baby to spine. And that can help kind of decrease a lot of that coning as well. And so if you're experiencing coning during your exercises, one, focus on your setup. Are you setting yourself up well so you can maintain a neutral position? And then we want to think about breathing. How are you breathing during the exercise? So are we inhaling into the back and then exhale to lift up and in, think pull baby to spine. And that can sometimes really help to alleviate a lot of the coning issues. The next thing is going to be, is it too heavy? Is the weight just heavy for you? Sometimes we just got to let it go. Prenatal fitness is all about this process of letting things go.
I let those pull-ups go.
And I'll just let them go. But we have some folks that like do not want to let go of pre-pregnancy exercises because it's part of their identity. They're like, hey, I identify as an athlete, and if I can't do this much weight on the bar, I can't do a pull-up, or I can't do this exercise anymore. Who am I? Like, who am I now? And I struggled with that during my first pregnancy as well, where pre-pregnancy, pre-kids, pre-motherhood, I'm an athlete. I define myself by my career. And so it can be really hard to kind of let go of some things that maybe you associate with your identity, and maybe performance is a big thing for you physically. But during pregnancy, it's going to be important. Try to let some of this stuff go so that we can choose movements that better serve us in the moment. And so if the exercise is causing a lot of coning, you're having a hard time not compensating as you lift, it may be time to modify and to consider maybe a different loading pattern, decreasing the load, or completely changing the exercise up. So instead of doing pull-ups, we're doing cable pull-downs. Instead of doing a barbell overhead press, maybe we're doing a landmine press or a banded incline press. And so there's a lot of different exercises that we can do.
One of the things that I really liked for my coning that I found to be helpful was squeezing a ball between my legs to help with that core activation. And if it was a movement that I really, really enjoyed, such as like lat pull downs, I really like lat pull downs. So to hold on to them a little bit longer, I did that ball between my legs, and that decreased my coning in some of the movements.
Absolutely. So like the anterior oblique sling could help to turn on the obliques a little bit more, and that involves the adductors as well. And so turning on that sling can help to engage the core a little bit more to help prevent that coning. So it's going to increase the density of the tissue of the abdominal wall, which is a big aspect to healing postpartum as well. And so let's talk about the gap, the separation of the abdominals. Everyone's really focused on, I have a 2-finger gap, I have a 4-finger gap. First of all, the muscles are always going to be separated because your rectus abdominis muscles are not one solid sheet of muscle. It's 2 separate muscle bellies. And so there will always be some sort of separation between the two of them. You will always be able to get a little bit of a finger in between the 2 muscles. Even for me now, I can get at least 1 finger in between my abdominal muscles because, again, they're 2 separate muscle bellies. They are always going to be separated. Now,
that's where you get that line down the six-pack.
I know when people like,
if it's not separated, you're not going to get that line. It's just going to be a 3-pack.
Think about the aesthetics. We need some separation for the aesthetics because that's definitely all we care for. Definitely not your ability to be functional because it's always going to be some sort of separation. So the goal to have no separation or no gap is not a realistic goal. It is not a necessary goal to have. And so the way that you can tell how far apart the 2 muscles are, and we're going to talk about why that's not the most important thing, is if you're laying in a supine position, you can place your fingers along the center line of your abdomen. You can do it at the belly button, below it, or above it. And for some of us, we might have more separation below the belly button. Most of us will have the most right at the belly button, and you might even have more above the belly button. And so what you're going to do is you're going to feel for the 2 edges of the muscle bellies, and you're going to put your fingers in between and however many you can get in. And then you're going to do some sort of abdominal activation, either like a sit-up, a crunch, something to just like turn the abs on, even just like a strong exhalation. And you're going to see how much closer the two muscles move together and how many fingers you can put in at that point. So it should ideally decrease in width when you activate the core. When you do your little crunch or you do your big exhale, the two muscles belly should move a little bit closer together. But the other thing that's probably more important, especially for function, is going to be how deep can you put your fingers? What is the density or the thickness of this tissue? Because what we're looking for is the tissue to get thicker, because that's going to make it more resilient and more easily or less easily manipulated. And so when we have an increase in pressure, that tissue can kind of withstand and maintain its shape a lot longer than a really thin piece. And so if you think about a plastic bag, like from the grocery store, how thin that plastic is, that's not how thin your abdominals is, but this is my reference. And then you think about having like a bag of chips that's a little bit thicker or a little bit more durable. And think about how easy it is to manipulate and change the shape of that grocery bag. Like you can blow air into it and like change the shape super easily, as opposed to if you had that like chip bag, it can still manipulate, it's still pliable, but it's not as easily manipulated. And then think about if you had something even thicker than a bag of chips, like I can't think of anything right now for some reason.
I mean, if you think about those grocery bags that are in those like California, those are some pretty thick ass grocery bags.
Like the Target grocery bag versus like the one cheap one from like the corner store. Yeah, those ones are, but if you just think about something that's a little bit thicker is harder to change the shape and manipulate as opposed to something that's super thin. And it's the same for our abdominal wall. And so if that tissue is thicker, it's going to be harder to change. It's going to be more durable. And so when you're doing your abdominal check and you're checking for that diastasis, we're also looking for how deep the fingers go in. So not just how many fingers can you put in, but how deep is that tissue. And that is probably more important than the width of the abdominals. And so what you're looking for is when you do that exhale, do your fingers push out? Do they come out further than they were? So maybe you can get it like super deep when you're in a relaxed position, but once you engage the core and turn the abdominal muscles out, the fingers should push out and they shouldn't be able to go in as deep. And that's like a really good sign that you have a functional diastasis, that there's not a lot of issues that may be happening with this diastasis. So you can still have a gap, but if that tissue is really thick and strong, it's not going to be as easily manipulated by pressure. It's not going to be a leak in your stabilization system. And so that's like a really, really good sign of what we're looking for. So instead of fixating on the width, we want to think about the density. How thick is that tissue when it comes to assessing a diastasis, whether or not it's a functional diastasis. And so what can we do to increase tissue density? And the top thing that you can do is lift weights. You can lift weights, which means we're just lifting some. It doesn't have to be weights. It could be bands. We're looking for things that have resistance that increases the effort. And so we're only going to be as strong as the demand we put on our bodies. And so if I'm only walking and doing body weight movements and yoga, my body is going to get as strong as it needs for me to accomplish those things. But if we think about our daily lives, there's going to be, we got to pick up kids, car seats, groceries. We got to carry all those bags in one trip. And so there's a lot of functional demand throughout our day that involves lifting things and carrying things. And now we don't need to go to the gym and become like an Olympic power lifter or elite power lifter. Those are two different words. I shouldn't have put them together. But like, we're not trying to become like lifting 1,000 pounds, or I think we just want to.
We're not trying to win gold medals.
I mean, maybe we are. Maybe we are trying to win gold medals, but
most of us are not.
As long as we increase the demand on our body, we're going to be stronger, and tissues are going to get thicker. Our bones are going to get denser if we do weight-bearing activities. If we lift weights, if we use resistance bands, if we do things more than just body weight movements. And so if you are plateauing in your diastasis healing, you may find that once you start lifting some weights, your tissue density gets a lot thicker, which is pretty cool. The other thing that we can start looking at is cross-body movements. And so when we think about the abdominal separation, it's not just bringing the two six-pack abs back together. It's not strengthening the six-pack abs or only strengthening the transverse abdominis, which is going to be the corset abs. We also want to think about the diagonal activation and bringing the muscles together diagonally in each way with the obliques. So the internal, external obliques kind of moving towards one another. either with like rotational activities or activating the anterior oblique sling that we kind of talked about earlier. So we're thinking kind of chest, oblique to opposite inner thigh. And that cross-body movement is kind of bringing everything back together. And so the crossover symmetry shoulder system, we have one on every squat rack in the gym. They're really awesome. And it's resistance. So it's a weight-bearing activity. So we're increasing the demand on our body, and we can do all sorts of rotational work with the crossover symmetry bands. What's really cool about them is you can attach them to a power rack. Like we have them here in the gym. They also have like a door anchor. So it's like this big strap that you could put around your door. And what's cool about it is it can actually slide up and down. And so it makes it like really easy to attach to a door frame. They also have wall mounts. So you can actually like screw it into your wall and
like a permanent.
It's
like
pretty cool. That's what we had in the old gym that we started in. And so you can attach them at various places in your house. If you have a power rack or squat rack, you can attach it to the squat rack. And they're really nice because they have different intensities too. So this is like a 40 and this is a 10-pound resistance. And so you can increase the demand as you get stronger as well. And so what we're looking for is movements that are rotational, cross body, like diagonal. So like diagonal banded pull down is probably one of our favorite exercises to do. Payloft press, payloft rotations, all sorts of banded work that you can do that really emphasize the cross body movement. So essentially think like my shoulder is moving towards my opposite knee, like cross body type movements. And that can really help to increase the density of the tissue and help to heal a diastasis or to make it more functional. So those, and we include a lot of those activities and exercises within our postpartum fitness programs so that we can help increase the strength of our core and the density of that tissue to heal diastasis. And what's really cool is you can also incorporate these exercises during pregnancy. So we talk about how you can't prevent diastasis, but you can strengthen the tissues during your pregnancy so it can withstand all that stretching and increasing pressure as well. And so we can incorporate these core type activities during pregnancy so that one, we have the motor pattern readily available to us in the postpartum period, but also we're strengthening that tissue density. And maybe that's why you and I have different diastasis. I don't know. Like maybe I work out more than you.
I mean, you probably do work out more than me, but it's also like Gina doesn't have stretch marks. I have a ton of stretch marks. Like our tissue, I think our tissue,
the genetic
Gina
lottery.
got the better tissue genetics, and I didn't get the better tissue genetics.
I don't know
if that's like.
I don't
great.
think we do that much stuff different. I think I maybe work out a little bit more than
Gina's
you
probably
do,
more intentional about her workouts. I haven't worked out in a week,
but I feel like you probably eat better and you're better with supplements than me.
Yes, I do. I am better at taking my prenatal vitamins. But back to the crossbody movements. My personal favorite of a crossbody movement, especially in my postpartum, is the ski erg. Oh yeah, the lateral pull with the ski erg. So you do some pulls forward and then sideways on each side. That's my current favorite.
The ski erg is
Shout out to Randy for showing us this
I know,
magic.
it's Randy at Spartak. It was the ski erg. If you have seen our Instagram stories, you'll see Roxanne, that's one of her favorite cardio machines to do.
I hate the
But
bike.
it's super versatile. You can do cross-body stuff. You can do flexion type stuff. You can do like lunges with it. It's really awesome. So that is not an ad. We just like the skier.
Yeah,
it's really
that was
cool.
just my favorite current crossbody.
That is a really great crossbody activity. And it's also like endurance-based as well. So when we're looking to heal diastasis or to increase the density of the tissue, we're thinking cross-body type movements. And so again, shoulder to opposite hip. If you want more exercises, check out our postpartum fitness programs or just go to our blog and just look up diastasis and there's like 50 exercises that you can do. They're not presented in any sort of format. There's just a bunch of exercises. Figure it out yourself or we figure it out for you in our postpartum fitness programs. So in addition to the strengthening exercises, so we're increasing the strength of the obliques, those cross-body movements to help increase the tissue density, we also have to consider how we are setting ourselves up. So if you recall, when we talked about coning, when the more extended positions, we tend to see more coning. That tissue is getting stretched more. It's more easily manipulated because it's thinner in this extended position. And so what we want to think about when we're trying to heal our diastasis is what is our common postural tendency? How are we standing generally? If we tend to be standing in this arch in an extended position, that tissue is just like always being stretched and stretched and stretched. And again, the thinner the tissue is, the more easily it is to manipulate it. The more we're kind of stretching and stretching this tissue, the more damage it's potentially getting. And so if you're having a hard time healing a diastasis, in addition to the exercises, thinking about our breathing pattern, again, belly breathing is not the way to go. We want that 360 breath. Think breathe into your back. We also want to consider our positioning and our positioning throughout the day, because for most of us, our workouts are probably anywhere from 10 to 60 minutes. And then we have 23 other hours of the day that are just filled to the max with things with kids, working, living our lives, trying to survive. But what we want you to think about is, how are we generally positioning ourselves? Are we always in this kind of extended position? Are we always kind of compressed towards one side? Do we have a little bit of like a rib flare going on? And so the positioning of our spine, particularly our rib cage, can also influence our diastasis healing, because if it's always stretched, it's going to make it a little bit harder for that tissue to kind of come back together. And so we can do movements like thoracic mobility, where we're focusing on the flexion and extension. Can we find rounding in the back? That's probably the most important one. Can we round in our backs? Round to side bending. Can you flex in the side body? So like stretch in the side body. And then we can also think about rotational work as well. So if you're finding that your diastasis is kind of lingering, or you're trying to like prevent it from being severe or more serious, we want to also think about, how are we positioning ourselves? And the way that we can kind of help with that is thoracic mobility. So can I move my thoracic spine and my rib cage in all three planes of motion? Can I move front to back, particularly the rounded position? Can I laterally bend it? And then also, can I rotate in the spine? And those things could also help to heal diastasis just based on positioning.
Another thing that we can do with our diastasis is, obviously there are professionals out there with pelvic floor physiotherapists, PTs, OTs, whichever one is available in your area, that can help you with your diastasis specifically. So like going to them and getting screened for pelvic floor dysfunction, diastasis, all of these things postpartum, just to see how you're doing. They can give you like individualized plans of care and exercises to kind of help your specific case. They could also just tell you like, hey, you're doing great. And that's always like just like a little check-in with your body to be like, you don't have a diastasis, or like your diastasis is completely fine. It has great density. Or like, hey, let's add in these exercises to your daily program and you can get your diastasis to be a little bit more dense and more functional. So I do have diastasis, but I've never had like specific, like when you think of like, oh, like let me close my diastasis with all this ab work. All of the exercises that I've ever received from pelvic floor PTs for my prolapse and my diastasis have never been like, oh, do a bunch of crunches or like obliques and stuff like this. It's like very intentional programs and exercises to heal like the full body, because it's all connected.
The other thing that you want to be looking for when you're working with a professional or you're working with like a program, even like our fitness program, is you want it to progress. And so we don't live our lives in a supine position. So if all you're given is glute bridges and heel slides and clamshells, that is not going to help you have a functional diastasis and help you heal your core. You're probably going to maintain it for a long time, because again, we're only going to get as strong as the demand as we put on our body. And so your programs with your PTs, the fitness programs that you choose to do, need to progress beyond heel slides, supine breathing, and glute bridges. Like we need to move upright. We need to learn how to squat and to move our bodies and to be in upright positions, load-bearing positions, and also that's going to really help us heal a diastasis postpartum.
So in summary, from what you are saying to me, diastasis, completely normal. We all get it. Unless your baby obviously is born preterm and you didn't get to that portion.
Do not recommend. We do not recommend that course of action to
you do that. But or your baby has like growth restriction, you may not get diastasis.
Also, do not recommend.
Most of us, all of us that get to term will have some form of diastasis, and that is normal. Normal.
There is nothing that we can do to prevent diastasis, because again, it's a normal adaptation of pregnancy. We need the abdominals to stretch and to spread apart in order to accommodate our baby's growth. Otherwise, our internal organs would be crushed, or our baby would be very tiny. And chunky babies are really cute.
I mean, look at Joan. She's really chunky.
Chunky babies are
Funny
really
story.
cute.
So really quick story. I actually have heard of a lady who had her abdomen like sutured together after having babies and then got pregnant again. And her abdomen did not separate anymore because of the way that it healed. and she was incredibly uncomfortable during her pregnancy, where she felt like her body was ripping from the inside because her abdomen could not separate to make room for that baby, and her baby was growth restricted because we were not able to allow that baby to grow. So diastasis is a good thing if you think about it.
And so during pregnancy, we can try to minimize hard cones, or this coning that occurs with increased pressure or exertion. So again, we're trying to avoid this kind of little mound down the center of our abdomen that occurs during exercise, if you're picking something up, if you're doing something that's exerting yourself. And so ways that we can minimize the coning is to first focus on our positioning. And so common reasons for coning is extending in the spine. We want to try to maintain a neutral position, particularly with like overhead movements and pulling down movements. So those are kind of the two that we tend to see a lot of coning here in the gym. We can also look at, is the movement too hard for us or too core intensive? And so really abdominal flexion focused exercises such as crunches, sit-ups, V-ups, and even pull-ups can cause coning because it's just too much for that muscle. And so avoiding exercises that are very flexion focused can also be really helpful. But you can still work on your core. We can do a lot of cross-body movements, rotational movements, some like anti-movements, so avoiding movement within the torso to help strengthen the core throughout pregnancy. So you absolutely should still train your core during pregnancy, but we do want to avoid exercises that cause that have that abdominal flexion and cause that coning. And so the more we can avoid coning during exertion, the less damage that tissue is potentially going to be. And again, doing all the training exercises and strengthening the core throughout pregnancy could help increase the density of that tissue, which could also help to heal in the postpartum period. And so when we get to the postpartum, we also want to be thinking about ensuring that our movements are progressing. And so just doing heel slides is not going to cut it. We also want to start getting upright, loading the movements, picking up some weights. So if you're seeing a plateau in your healing postpartum, we want to consider, are we lifting weights? That might sometimes help increase the tissue density. We want to think about what is our general positioning throughout the day. We don't want to live in a neutral position. Like, we're not like robots where we must live in like a neutral spine position, but we want to make sure there's good mobility of our spine and our rib cage. Can we find flexion? We're rounding in the back. Extension, can we rotate? And then also laterally side bend. So ensuring that we have good mobility of our spine is going to also help to heal diastasis. When it comes to diastasis, it's not just the separation. We also want to be thinking about the density, or how deep we can kind of push our fingers in. And what we're looking for is, with exertion or activation of the abdominals, the fingers are going to move out and the abs are going to move closer together. So that would kind of be the goal. You can work with a professional during your pregnancy. You can work with one in your postpartum period, such as a pelvic floor physical therapist, an occupational therapist. You can work with perinatal fitness trainers to help increase the density of that tissue during pregnancy and the postpartum period. But in summary, diastasis is normal. It's a necessary part of pregnancy. We want it to happen, but it doesn't mean that you have to have it forever postpartum. And having it for a little bit of time postpartum, or even a year postpartum, can be pretty normal. So thank you for listening to this week's episode all about diastasis. So hopefully you have an understanding that diastasis is necessary. It's a normal adaptation. There's nothing that we can really do to prevent it, but there's a lot that we can do to decrease the severity of it and to help us heal in the postpartum period. And so if you're wanting more support during your pregnancy and the postpartum period to help keep your core strong, to keep it functional, join our online fitness programs. We have our prenatal fitness programs and our postpartum fitness programs that are really focused on strength training, strength and conditioning to keep you strong throughout your pregnancy, help prepare you for birth, and then also help you to heal in the postpartum period. And you can use code STORY10 to get 10% off any of our fitness programs. If you're pregnant and you're wanting more support during your pregnancy, you can join our childbirth education course and our prenatal fitness programs. If you're postpartum, we have tons of postpartum fitness programs based on what you're looking for, depending on the amount of time that you have, how you like your workouts delivered, and whatever sports-specific needs that you have.
So if you are a professional, we have a birth workers and a professional fitness trainers course that you can learn from us while earning contact hours or continuing education credits. And you can explore all of our courses at our website at www.mamastefit.com. And again, use code STORY10 for 10% for listening to this podcast and YouTube video.
So we release new episodes every Wednesday and new birth stories every Friday. If you would love to support us, please tell everybody about our podcast, like and share, heart it, leave a comment, whatever it is on your platform. You can listen to this podcast on Spotify, Apple Podcasts, YouTube. If you watch the YouTube video, we make like 0.01 cents per view, so that's always helpful for us.
This podcast is sponsored by Needed, a perinatal nutrition company for both pregnancy and postpartum. We utilized all of their supplements during our own pregnancy and postpartums, and you can use code MamastePod for 20% off your own order.
This podcast is also sponsored by Crossover Symmetry. Crossover Symmetry has these shoulder band systems where you can attach to power racks, to your door, or even to your wall. And they also have a hip core system, which is like a glute band that you can put around your thighs to help strengthen the glutes and the core musculature. We love the Crossover Symmetry and we use it in our gym. The equipment is high quality. It has lasted us years in this gym. And so if you want to get your own shoulder system or hip core system, you can use code MamasteFit for 20% off your first Crossover Symmetry order.